Hello, Professor.
Hello, Parham.
I hope you are doing well. It's such a
Yes, I'm very well. Thank you.
such a honor to be with you in this platform, and thank you for accepting the interview.
It's a pleasure. Mm.
So, so first of all, I want to introduce myself to you. My name is Parham. You know that already. I'm a sixth-year medical student, and somehow I'm on the same path as Michel Foucault was. I'm not satisfied with the empirical science, and I'm gathering through all knowledge, and again keep returning to the Socratic insight that I know that I don't know. Ignorance is
Mm.
valid. So
It's the starting point. Yeah.
exactly, again, to get starting point. And you know already that Foucault was a Ludwig Binswanger student, the first.
Hmm.
And again, he went through the Nietzsche, Heidegger, and everything, but yeah, he was all there. So I think I'm on the same path. And so to start with you, I think who gonna watch this video, they already know you. But I want to ask you to introduce yourself briefly.
Okay. My name is Emmy Van Durzen, and I have been an existential psychotherapist for nearly 51 years. And I have created numerous training organizations and international associations for existential therapy, and I have written nearly 20 books.
That's great. So in Iran, there, I mean, in this uh, through these years, as I got to know about you and existential psychotherapy, they have translated your books and they published it. And it is, I mean, whoever is going to read your books and the insight through all philosophers and psychologists, it's better to take a step at the first. So I'm going to start my questions. So we have 40 minutes, and I hope that we can cover all of them, but I will start with the important ones. Uh, the main question, why philosophy, and why is philosophy relevant in the field of psychology?
Absolutely. Well, you may be aware that I studied philosophy before I studied psychology. So I did a master's degree in philosophy with French philosopher Michel Henry at the University Paul Valéry in Montpellier. And my objective was to understand human existence. It was only really through my relationship with a medical student who decided to specialize in psychiatry that I started to work in psychiatric hospitals just with my philosophy degree. And this is what threw me into the awareness that there was so much to learn. I mean, I went through his 4 years of psychiatry studies with him just as an observer. And he came with me to my psychology studies as an observer. But even all of those studies weren't enough to explain what was happening to these individual people who were in distress and why this was happening. And I did find that although psychiatry and psychology helped and gave me further sidelights and insights, it was philosophy that was the deeper way of approaching all these issues. And I could not understand how philosophy was being so underrated and how few people took it seriously when it is such an important approach to human existence. It should be at the foundation of everything we do because it is the search for wisdom, and it is the search for understanding and truth, and it is the search for getting this much wider perspective on what is happening in the world, what is happening between us and other people, what it is all about, how we can find meaning, and what is going on in ourselves as well. So philosophy, the love of wisdom, was regenerated in my mind many, many times over as the most important search. And so belatedly, after working in the field for something like 25 years, I went back and did a doctorate in philosophy at that later stage, which was about Heidegger's ideas about authenticity and inauthenticity in relation to psychotherapy. So this weaving of philosophy and psychology and practice and dialogue really is the only way forward, I believe.
Yeah. Before I get to the second question, I think the way that now, philosophy, the medicine, and the psychology, through this, we can call it as a circle. Before, in the Middle Ages, there was a great philosopher in Iran, the Avicenna or Ibn Sina. We are calling them in Arab or Persian language as a Hakim. Hakim means who knows all of those three circles: philosophy, psychology, and medicine. So the second question is that how do pre-existential philosophy contribute to our understanding of human existence?
Well, existential philosophy will need to be defined, first of all, because it is a very wide field as far as I'm concerned. And as I'm sure you are aware, people often mistakenly assume that when we speak about existential philosophy, we're talking about existentialism exclusively. But that's not the case. There are many philosophers outside of existentialism who have investigated human existence. There are, of course, in the last century, many philosophers who have more or less neglected human existence and who have focused exclusively on epistemology and logic and language and on basically making knowledge the only objective of philosophy, which is a grave mistake, I believe. But in fairness, philosophy, as we've known it across the world, and particularly looking at Athenian philosophy, has always been about human existence and how to live. So that is a very fundamental exploration. And the more cross-culturally we do that, the more we learn as well. So I think it's very important to go beyond that sort of Western approach. And you are already mentioning Iranian philosophers, and we know very little about them in Europe. And that's obviously a pity. And we know a bit about some of the Eastern philosophers like Buddha and, Taoism. And there are many, well, Confucianism as well. There are many worldwide philosophers that are thoroughly neglected, but that have an immense amount to contribute as well. And as you probably realized, in existentialism, that was something many philosophers were getting very interested in. So Martin Heidegger had conversations with Suzuki, for instance. And, Nietzsche obviously was hugely interested in Zarathustra, which is quite an interesting way of bringing these different approaches together as well. So any existential philosophy should really benefit from that cross-cultural wisdom that has gone through many millennia of human history, you know, wherever there have been human beings in the world, they have asked these big questions. Why are we alive? What is a human being? How should a human being live? What can we know? That comes into it too. How should we be with each other? How should we contribute something to the world? Basically, at the end of our lives, what would we like to look back on and feel we have achieved in being alive? So, yeah, it's as big as that. And I think it is because it is this big that people get confused about it and they just avoid it altogether. And they prefer going down these much more narrow path and, you know, stick to the facts with a scientific approach and forget to actually reflect for yourself and in a critical way about what it all means and what it is all for.
That's right. That's right. So we know that after 19th century in the history of philosophy, the analytic philosophy has been separated from the continental philosophy. So existential philosophy is the part of the continental. There is idealism, structuralism, and others. But somehow this continental philosophy is, I mean, the way that it is different with analytic is that it is close to the poetic. You cannot call them those philosophers as a just philosopher, but such a poetic, such a we can say in the myth or such is going back through the I mean, history, pre-Socratic philosophers who are not just be on the logic way. So how do you think this literature or the poetic is gonna work in the psychology field?
Yes. So, yeah, that's a very important point. We need to reach beyond philosophy as well. And, well, most people get their education in philosophy through reading novels, quite frankly, because not only are existential ideas obviously in good any good novel is actually dealing with existential issues, but also drama, theater plays in the same way. Well, read Shakespeare and you will see that it is a complete exploration of existential issues. Goethe, for instance, is the same thing. Um, it's everywhere. All good authors are on that same path. And I would go further than that. I would add art as well and music as well, because the explorations that you go into when you explore the world through art, through representation and aesthetics, and through music very much as well, is about exploring those very same things, but at a different level, you know, at the level of sound or at the level of color or form and shape. And as you know, most early philosophers were very interested in those forms, and philosophy in the past used to have one branch which was called aesthetics, which looked at all of those things. But that is very much getting lost. It's quite extraordinary how impoverished academic philosophy has become over the decades.
Yes, that's correct. Nowadays, I'm reading Gadamer's book, The Truth and Method. It is a bit difficult. We are studying together, and there is a teacher who is teaching us through the book. So when I was reading the book, I got to know that why the existential psychologists and the psychotherapists are not going through the methods or the diagnostic method to analyze the patients, the person, the humans. So as, for example, my teacher said, the Gadamer, the title of the book of the Gadamer is that truth and method with the question mark, how you are going to reach the truth just with the method. So I want to ask the fourth question, that is psychology currently facing a crisis by the diagnostic method and those list part of treatments?
Yeah, but it is not just a crisis of psychology, is it? It is a crisis of civilization, because psychology is just the handmaiden of how scientific approaches have become frozen in their methodology rather than in the search for truth. So when you apply that to psychology and psychiatry, and you reduce human beings to these kinds of categories where they get frozen and where they get turned into a lot less than what they actually are. And, as anybody knows, these diagnoses will change historically. So people who have been through the system for a long time have large files because they have had many investigations and many diagnoses and usually many medications as a result. And none of that actually ever really addresses the problem that the person has presented with, because that problem is always an existential problem, even if it was generated by a neurological cause, which of course happens in some situations, like for instance with epilepsy or certain types of autism. Even then, it creates a certain way of being in the world that raises its own problems. And if we aren't fit to address those problems, if we are afraid of those human problems and those existential issues, then we won't even hear the other person. We won't really be able to be in a proper dialogue with that person, and we won't be able to guide them into an examination of their internal world and of the way in which they experience things. We can only approach them from the outside, and that often means doing violence to them and missing the point. But as I was saying, that doesn't just happen in psychology, that happens in many other ways as well. Most students of any kind of study direction will often tell you about that. They will tell you, they went to study literature, but they find that the way that is being taught does violence to their experience of the literature when they first had their favorite authors and were reading certain pieces or certain books that became very close to them, but they felt that they were being ripped apart by the analysis that was being done of those books. So this is something that has happened to humanity as we have become sort of capable of analyzing things and categorizing things. We have fallen into the trap of believing that that is where we find life, when actually where we find life is in the living and in the dynamics of it and in the historical progression of it, in the evolution of it, and in the exchange with other people, in the dialogue about it. And all of these things transcend what is now being done in this scientific mold. And so we really need to allow ourselves to see that and to realize that there are better ways and much more effective ways of approaching people's difficulties in living. And I think people are becoming aware of that. There is again more and more of a critical movement now, and I'm quite optimistic that there are enough people in the field who see this and know this from their own experience, and who don't want to just collaborate in this processing of the human beings, who want to bring out life in a person and meet with the person in a real way rather than processing them and basically keeping them under control in some form or shape.
Yes, that's correct. I remember 7 or 8 years ago when I was in school, that some of the teachers were forcing us to memorizing the poems, the history of the poets, like what happens on their life. But when I start to study mostly the second Heidegger, or we can call it old Heidegger, I got to know that how I was in the darkness, exactly. I was in the cave. And when I'm going to have a contact or to get in a communion with the word of the literature. So, yeah. Now, the final question. Could you share some insight about your relationship with Ronald David Laing, and as well as your critiques and opposition to Lacanian psychoanalysis?
Well, that could be a long story. So, as I said, I began working in psychiatry in the early 70s. I think the first time I did voluntary work in the hospital of Montpellier, which was then called Fondorel, was in 1971. And of course, I realized very quickly that most psychiatry and much of psychology was dominated by the Lacanian approach in France at that time, which consisted of listening to the words a person would say, and then to find meanings to those words that would get you into a sideway exploration of the connections, of the frameworks of linguistic meaning of that person. Now, this was very interesting in many ways, and a sort of, as an intellectual game almost, it was, mind-blowing at times, but it could also get quite abusive because analysts could make interpretations about a person from their own framework of meaning rather than in a phenomenological way from actually exploring what that other person means by those words. This was very obvious to me because, of course, I had moved from my birth country in the Netherlands, where I spoke Dutch, to my adoptive country, France, where I spoke French, and these are two very different languages. And it was obvious to me that my associations to words were often very different to the psychoanalyst who was interpreting my words to me. So I was very intent on not falling into that particular rabbit hole and staying on target in finding out what the real meanings were that the person was trying to express, rather than to try and come to an interpretation of those meanings from their words. And that is about going to the essence of somebody's experience. Now, probably around 72, somebody pointed out to me that my preoccupation with that was reflected very much in the work of R.D. Laing, who had then just been translated into French. And I loved his books, and I began reading everything that was translated and read it over and over again and used it in my master's dissertation in philosophy, because he was a rebel, he was a bit of a revolutionary, and he was saying things that nobody had been saying at that time, or at least not to my knowledge. Of course, later on, I discovered that there were many other people, like Karl Jaspers, for instance, who had done very similar explorations. But, and sometimes I would say in more interesting ways. But anyway, it was an important influence on me, and it opened my mind a lot to different ways of doing things. And in large extent, because of that, I then went to work in the Revolutionary Hospital of Saint-Alban in the Massif Central, which is a hospital where completely different ways of working with in mental health were established as early as the 50s and the 60s, and the walls were broken down, and a community was set up inside of the hospital where everybody contributed to that community, not just by working in that community, but also by socializing in that community. Equally between nurses and doctors and patients, and where basically the time for the 2 years I worked there, very full time, I was with the patients most of the time, from the moment I got up to the moment I went to bed at night, because it was so all absorbing and it was just a different way of life. So I learned an enormous amount from that. And from there, I decided that I wanted to work in London with what was then called the anti-psychiatrists, which was the movement that R.D. Laing had created with his colleagues. And I met a lot of his colleagues in Milan at a psychoanalytic conference, I think it was 1973, and was invited to come meet with them in London, which I did. And a year later, I was offered to come and work with them. So then I came over and I lived and worked in a therapeutic community there, and worked in the crisis center, and used to go to the meetings of the Philadelphia Association with R.D. Laing. Now, it was a very difficult thing to do because I was adding a third language and a new country, and I was depriving myself of the authority of being a clinical psychologist and being in a sort of professional situation, and exposing myself to being completely equal with everybody, living 24/7 in a therapeutic community. So it was a very challenging situation to go into, working with people without using any medication. And actually, most of those people had diagnoses of schizophrenia. So it was a very tall order. But I also found that R.D. Laing himself was probably by this time a bit overwhelmed, A, by what he had created, and which wasn't really feasible in the long term, and B, by his own life situation, having been overtaken by this extreme wave of fame that he was experiencing, which I think had really made him lose track of himself. And so he had become a little bit grandiose. So I was very disappointed with what I found there, which was, as it turned out, much less revolutionary than what we had been doing in Saint-Alban. And so very quickly, I became quite critical and felt I needed to search for an alternative way of doing things, which would take all of those experiencing into account, and which would create a much clearer and much stronger foundation for existential work. I thought they were all working existentially, but actually they were all completely lost. What they had called being existential was, a kind of free for all, where everybody could just do what they wanted. And what that meant in practice is that people were self-medicating a lot. They were smoking hashish, or they were drinking a lot of beer or other alcohol, and they were basically not working towards finding a path out of their distress. And this is what struck me was a very important thing to do, to find a disciplined way that was an alternative to the psychopathological path, but that wasn't a free-for-all path, but that had a structural element that would give people a sense that they were safe in their explorations rather than completely abandoned and lost in a world that was still confusing to them and where they hadn't found a new way to be. They were just not fitting in with society anymore and sort of liberating themselves. Liberation is never enough. You liberate yourself from a stress and a pressure in order to use your freedom and your new consciousness to go somewhere and do something. And this is what I took to be my mission in life, to find a way for people to do this. And I'm still in that process, you know, it's not finished. There is so much more to explore and find out about. It needs a lot of people to do this for a long time before we begin to have that clarity. But we got somewhere with it, though.
Exactly. It reminds me the definition that Heidegger says about the truth and the freedom. And it's somehow it is not just in the political ways to be liberated, but it's exactly in the phenomenological perspective that when I'm getting through the truth again, it's disappear. And I need to again to look at it or get inside with it.
Yes, and I need to keep living my life and be tested by the reality of everyday existence and figure out what each of those experiences tells me about what I know and how I can live better than what I'm doing. It is a constant learning process.
Exactly. I think we have just 7 or 6 minutes left. For conclusion, I want to ask you to give a comment for the beginners in the mental health, physicians or philosophers, psychology, psychotherapists. What is your comment for them?
Well, first of all, welcome to a wonderful world where you are much needed, because there are not enough people like you who are interested in discovering what is really going on. And so if you are prepared to follow this vocation and to immerse yourself in this, you are going to have a very interesting life. And I hope you are going to be able to allow yourself to be with that fully and completely, that you will allow yourself to be modest and humble in that process, and always turn to the writings and the studies and the research that other people have done, but never swallow it whole. Always pass it through the sieve of your own experience and of your intuition about what is right and wrong and what is true and false. Have lots of dialogues about it with other people and keep an open mind. It is about being prepared to do this lifelong research about what it is to be a human being and how we can get lost as a human being along the way at so many points and in so many different ways. Never put it at a distance from you. Always incorporate it. Always allow yourself to approach it both subjectively and objectively. That is the purpose of phenomenology, to bring together a subjective perspective and an objective perspective, and to have this constant dialogue between those different sources of understanding. If you do that, you will discover different ways of being, and you will find a deeper and deeper and deeper sense of meaning in life. And this will keep you on your toes, it will keep you engaged, and it will keep you aware of how much need there is in this world for people to do this, and how lost human beings have become in the matrix of this very artificial world, where we have forgotten to listen to the human awareness inside of us, and we have forgotten to listen to each other as well.
Thanks a lot. It was a great pleasure talking with you, have an interview with you. I hope in upcoming years I would see you in a live, not in this kind of platform, in an online platform. And if you would be agree, we can finish now the interview. And
certainly, I hope we meet again. Maybe you will come to Turkey, where we have the European Congress for Existential Therapy in May. That would be a great opportunity. But otherwise, I'm sure we'll meet somewhere, sometime. Thank you very much for your interest and for your work. Keep going, keep your courage, never give it up. It's important what you're doing.
Thank you so much. Have a great moment. Bye-bye.
Bye, Parham.